industries. Thank you.
Hear, hear.
Member for Higgins.
Hear, hear. Thank you, Deputy Speaker. I'd like to thank the member for Mackellar for bringing forth this matter of public importance. Like her, I am a fellow doctor and I am heavily invested in public health problems and harm minimisation in relation to gambling, obesity, as well as alcohol misuse. These were problems that I dealt with on a daily basis on the front line at the Alfred Hospital for the 13 years that I worked there, and certainly every day for the 26 years of my career as a doctor. Just yesterday, the Multi-Partisan Health Committee launched the parliamentary inquiry into diabetes and obesity. Now, this can't happen soon enough. This will be a far-ranging inquiry, much like our long COVID inquiry was, which will delve into the drivers of diabetes and obesity. As you know, these are bedfellows. They march together. They are syndemics, in fact, where one problem synergistically interacts with the other. And they're driven not just by traditional, conventional health risk factors, but by the social determinants of health. They're driven by poverty. They're driven by poor education, by financial insecurity, by a lack of access to fresh fruit and vegetables. These are the factors that actually drive over half of all health outcomes, and diabetes and obesity are no different. So the health inquiry that we will be now part of and that I will be part of will be doing a deep dive into these social determinants that require not a prescription pad but a parliament to solve. And that's why I'm standing here in this parliament, one of those reasons. There's no question that obesity is at, or I would say, pandemic levels in Australia. 1 in 4 children are affected and 2 in 3 adults are affected by obesity and overweight. So we do need a holistic approach to tackling this problem. Junk food advertising is certainly something that we as a government are looking at, and we've committed $500,000 to commission the University of Wollongong to look at how unhealthy food is marketed to children, and I welcome that. This is in addition to the already Health Star rating that we have on food packaging. That is something that's public-facing and at supermarkets, but it's clearly not enough. On the matter of alcohol misuse, I would say this, that my observation has been that people resort to using alcohol or indeed other illicit drugs as a maladaptive response to life stressors, acute stress or indeed chronic stress. And this is where we really need to focus again on the drivers of mental health. And mental health reform is the forefront of our government, and our budget response demonstrated that with over $500 million committed to mental health reform. And I just want to focus on some of the things that we are actually targeting in that package. One of the things we're targeting is workforce. Now, we know that we're just simply not going to have enough psychiatrists to deal with all the mental health impacts that we have in our community. So a substantial amount of that funding is actually going towards supporting the training of psychologists. We have dedicated significant amount of money to upskilling the allied health workforce so that they understand what mental health first aid means, and that means that we all become part of the solution. The other aspects are 500 internships for psychology trainees. We're looking at redesigning the entire psychology pipeline. It is unclear to me as a doctor why it takes 6 years to train up a clinical psychologist. That is the same time I spent in medical school. Now, the problem with that is that it acts as a drag on training and people drop out. You get attrition of highly skilled, intelligent, hard-working, committed students, and they fall away simply because they can't deal with the duration. 6 years is a long time to be not earning a decent income and to be not working. So we will be looking at all of that. And in addition to that, we're committing funding to 2,000 supervisors to actually get paid, to get re-credentialed, re-enter the psychology workforce in order to supervise trainees and beef up that pipeline of workers that we need in order to support our community going forward. But that's not the only thing. There's no point even talking about referrals to psychologists unless you support the primary healthcare network. And that's something that we're doing in a stunning way by tripling the bulk billing incentive. Patients, frankly, just need to get to see their GP as the first port of call. So there's a lot that's going on at the table, and focusing on the social determinants of health as well as specific interventions is really, really important.
Member for Wentworth.